Hello, my name is Lance French. I'm a student nurse. This is my return demonstration for a heparin injection. So initially I will grab the materials I need, which are one pair of clean gloves, at least 3 packets of alcohol pads, one 2x2 sterile gauze, a 1 cc TB syringe with a 27 gauge needle attached, the practice glass ampule, and a filter needle. So I'm going to recite and explain the 6 rights of medication administration to begin, and those are that I will administer the right dose, and I see that the medication order and the MIR specify for 1 milliliter of this heparin injection. The right route, this will be subcutaneously, the right medication, the right documentation, the right patient, and the right time. So I will check the medication order and the MAR for this heparin order again here. So now, while holding this heparin ampule upright, I'm going to tap it to remove the medication in the top of the ampule, and I see that I've gotten that evacuated, which is great. So now I'm going to use this gauze pad, and I'm actually going to snap this off, breaking this away from my body. Now I'm going to set that aside, and I'm going to attach the filter needle onto the syringe. So we have the sterile aspect exposed now. We'll have the sterile syringe. I'll unattach that, and I'll attach the filter needle now. Okay, now I'm ready to draw up this because it has likely glass fragments into it. So now I'm going to pull up my 1 milliliter. And I have some air in there. I'm going to eliminate that. Okay. Now I can use the scoop cap method to get rid of my filter needle, and that's going straight into the sharps container, which I have next to me. And then I'm going to apply the needle for injection. I'm loosening that. I now have my 1 milliliter. I'm going to scoop cap that and set that on a clean surface. So now I'm going to walk into knock on the patient's door and introduce myself and identify the patient by 2 methods, their name and their birth date, explaining the medication and this procedure. So I'm going to locate a site on their abdomen to perform this injection, and I'm going to clean it with an alcohol pad, and cleaning in a circular motion from the inside out of the injection location. So now I'm going to don these gloves and making sure that I'm going to perform the correct thing. I'm going to check the 6 rights of medication again. The right dose, 1 milliliter of this heparin sulfate injection. The right route, subcutaneously at the periabdominal fat on the abdomen. The right medication, this heparin sulfate. The right documentation has been begun. The right patient I've identified by 2 methods of identification, and then I'm going to write down the correct time, and then I'm administering this at the correct time, as on the medication order. So now I'm going to, with my non-dominant hand, pinch up a skin fold, and I'm going to prepare. And so I have this pinched up skin fold. I'm going to inject into that. I'm stabilizing this by my non-dominant hand, making sure I'm not aspirating anything, and injecting the medication in the 0.2 milliliters of air that I drew in. Now I'm going to take my new gauze pad, I'm going to scoop cap my needle, go straight into the sharps container, which is right next to me. Take a new gauze pad, I'm going to blot that injection site and hold that on, so making sure it's not, that I'm not rubbing or I'm not massaging. So now I'm going to document in the MAR that I've administered the heparin medication as specified. And that now is the end of my procedure.